Hello and Assalamu alaikum. Ultrascan Diagnostics. Here, this is the CBCT of the patient which you had requested. The area of interest is the lower right 6, 7, and 8. Starting with the lower right 6, 7, and 8, I would first prefer to look at the axial view. Let's zoom into the area of interest, which is the lower right 6, 7, and 8 region. Now, from the axial view, we're looking for any kind of cracks or any lesions that we can see on the buccal lingual dimension. You don't see any major cracks, anything majorly problematic. However, the 5 shows a little bit of a bone loss on the mesial aspect, but other than that, the 6, 7, and 8 do not show us anything significant. No cracks can be seen on this view. Now we are going to move our to the transaxial view, which is a true cross-sectional view. Let's start here. And let's see. So this is the mesial part. Again, two roots in the mesial of the 6, the interradicular area, and then we have the lower right 6 distal root. Again, nothing very significant. Maybe a little bit of a class 1. This is the lower right 7. Again, we've got a dentinal lesion here developing. So patient probably has a class 1 cavity, which you can see here, but nothing very significant. Very curved roots, but no periapical radiolucency, no significant problems in the 7. And then we've got the 8, and the 8, ladies and gentlemen, has very interesting root morphology. We don't see the roots going all the way down to the inferior alveolar nerve. However, we see a idiopathic osteosclerosis or a little bit of a cementum deposition at the apex, which you can see very clearly right here. So we can definitely confirm that the root morphology. So we can see that there is no clear change in the cementum. So it could be a cementoblastoma or it could be hypercementosis at the apex of the 8. There's one more view which is known as the sagittal view. This is basically the side to side view. And here also we can see if there is anything significantly deposited at the apex. So you can see right here that we've got some form of deposition right here, and you can see it on this view as well. It merges with the root apex, so there's no clear cementum, and hence we can assess that it could be hypercementosis. And why is this important? Because this can definitely play a very major role at the time of extraction. The tooth itself is not very close, but the hypercementosis is also very closely associated with the inferior alveolar nerve right here. Thank you very much.